Okay, so I'll be sharing my slides now. Okay, so everyone, do you have any doubt with the previous class? Are you clear?
Till now, no, ma'am.
Yes? Okay, so I think if you remember in the previous class, we have learned about what are the different levels of organization, what do you mean by homeostasis, right? So, so all this we have discussed all this. Okay, so all this homeostasis, what are the different levels of organizations? So all this. So if you remember, I have said that we'll be discussing now. Okay, what do you mean by feedback system? Okay, so what happens? Like, suppose if there is any form of this equilibrium in our body, like if you remember, I have said homeostasis. It means the maintenance of any form of balance. So our body always try to maintain the homeostasis. Okay, we always try to make sure that each and every parts in our body, each and every system, it is functioning in a very well manner, in a balanced manner. So now we'll be seeing this feedback system. Like what happens, suppose if there's any form of this equilibrium. So what usually happens in our body system? Okay, so here we have. So we have three basic components if you see in the feedback system. Okay, so we have the receptor, the control center, and the effector. Okay, so what happens, like if in simple term, what do you mean by the receptor? So the receptor, this is where the signals or the stimuli will be received. Okay, so the control center, what is the control center? So the control center is where after receiving the signals, they will try to give some output, and effector means that is the change. So these three basic components, it happens everywhere in whenever there is any form of disequilibrium or disruptions in any parts of our body, okay, in which we have the receptor, means this is the part of the body which will receive the signal or receive the stimuli, okay, and the control center, that means this is like a part of the system where once the receptor receives the signal, it will be control there, then they will try to see, okay, then they will uh, try to make some changes. And effective means what is the output of that output, that means whatever which comes out or what are the changes that is being made, that is called as a effector. Okay, suppose if you see an example here, some stimulus disrupts homeostasis. Suppose what stimulus I'll give, suppose for example, a body suddenly the blood temperature, the body temperature suddenly rises. So that is one form of disruption. So because of the rise in the body temperature, that is one form of stimuli, or that is one form of signal. Okay. So this, what will happen? All this will be sent, the control condition that is monitored. So this will be sent to the receptor. So the receptor will receive the signal that, okay, the body temperature now it is very increased. So what happens in the control center? They will receive the signals, and based on whatever changes needs to be created, they will provide the output. And effector means that is where the changes usually happen. So these three actually important component happens here in the feedback system. Okay, so the figure might be a little bit complicated, but you don't have to be worried with that. Just remember that in any feedback system, we have three types. We have the receptor, the control center, and the effector. Hello? Are you clear
Hello,
with
ma'am.
Yes, ma'am.
this?
Yes, ma'am.
Okay,
Yes,
you don't,
ma'am.
okay, don't, this diagram might be a little bit complicated, but you understand it from the simple one, which I'm saying. Okay, the receptor is like, this is the person who will receive the signal. Okay, then control effector, this is where that is that center where whatever signals we are receiving, it will be sent to the control center. So it's like controlling. Okay, so they will try to control. Okay, suppose rise in body temperature is there, then what the control center will do, like for example in our body, you will be learning later, we have hypothalamus. Okay, so this hypothalamus, it is where it is that area of the body which really controls our body temperature. So whenever there is a sudden rise in our body temperature, so that stimuli, that rise in body temperature is like a signal. So that signal will be sent to that hypothalamus. So because of that, our body will try to start, then because then that will be sent to the control center. Then in the control center, what will happen? They will try to think of, okay, what are the solutions which we can do in order to bring down the body temperature? And after that, what is the effect? Effect means that is what is the changes that is being made from the control center. For example, the body will start sweating. So that sweating means that is called as the effector. Okay, so this is like, in this we have to remember we have the input and the output. And between the input and the output is the control center. Okay, so input is what goes in and output is what goes out, or what is the changes that is being made. So in each and every disequilibrium or any disruption in our body, we always have these three components: the receptor, the control center, and the effector. Do you have any question? Yes?
No, ma'am.
Sleeping. You're not in your bed now because somebody is sleeping. Okay. Okay, I think you might be a bit tired also, but anyhow, just remember in here, in the feedback system, we have this. And we also have, okay, this is the same thing. Okay, so this is like whenever any disruption change, we always try to maintain a balance. Okay, this one, so it's no need for you all. Okay, then after that, we have two type of feedback system. We have the negative feedback and we have the positive feedback. So suppose what is a negative feedback? Okay, so what example here I have given is blood pressure. Suppose if a person's blood pressure suddenly shoots up, so that is not normal, because normally a blood pressure, human being blood pressure should be around 120 by 80. But suppose if the blood pressure suddenly shoot up to 140 by 100, so that is a very kind of disequilibrium or disruption. So in order to bring down the blood pressure, the body tries to use the negative feedback. Negative means we are trying to decrease, okay? And when we say positive feedback, for example, during childbirth, or when another example I can give is, suppose if you are really very stressed out. So in those type of situations, so what happens when you stress out, you'll be needing so much of energy is required because you're already using so much of your energy. So in that type of situation, our body tries to increase its this one feedback mechanism, that is called as your positive feedback. Negative means we tries to bring down. Suppose another example of negative feedback, suppose suddenly if a body temperature increases, so we are trying to decrease the body temperature, right? So that is called as your negative feedback. And another example for positive is, suppose our body blood sugar, it blood glucose level suddenly becomes very low. So our body will try to increase that. That is called as your positive feedback. So why do we do this? In order to maintain the balance or the equilibrium. Okay, are you clear with the positive and negative feedback? Yes, please answer.
Yes, ma'am.
Okay, so this is one example. This one is you don't need. Okay, I'm just giving in the slide. You will not. Okay, so now we will see what are some of the anatomical terminology. Okay, so we have so many terminology. All this you'll be in each and every system or in every organ when you will study later. You have to remember all this anatomical this one. Okay, positions. So first we have so if you see from the diagram itself, okay, so our body is mainly divided by one imaginary line, which we call as a midline, okay? So superior means it is above or top or towards the head, okay? So that area we call it as superior, and the area down below we call it as inferior, okay? So because in many systems, in many organs, you'll be hearing this word, okay? Superior, inferior, posterior, anterior. So you have to be very clear with this. Superior means up and inferior means down, okay? Clear with this? Yes.
Yes, ma'am.
Yes, ma'am.
Yes,
Yes,
ma'am.
ma'am.
When you come back, okay, to physically to the college, I'll be asking you all, okay, regarding this position, because this is very important. All of you needs to know, okay, which is superior, which is inferior. The next one, we have the anterior and the posterior. Okay, anterior means it is the front. Okay, I didn't give the diagram here. Okay, anterior means the front and posterior means the back side. Suppose if you are standing, so your front part of the body, it is called as the anterior, and the back side, okay, it is called as the posterior. Okay, clear? Yes,
Yes,
please
Yes, ma'am.
ma'am.
respond. Okay, anterior, it is the front part and posterior is the back side. Sorry, I forgot to give the diagram here. Okay. Then when we come, then another term is there where we call out the proximal and the distal. Okay. So the proximal, as here also, we have used an imaginary midline, if you can see from the diagram. So the area which is nearest to the origination or the nearest to the midline, that is called as your proximal, and the area like your palm, your toes, these are very far from the origination, we used to say. So this is called as your distal. So similarly, even in your leg, okay, so your hip, the hip portion will be called as the proximal, and your toes, okay, these are called as a distal. Okay, clear? So this is called proximal and distal. Okay, please remember these, okay, because all this is important. So the next call is we have the superficial and deep. So from the word itself, superficial means it is only the surface. So superficially, whatever it is in the surface, that is called as a superficial. Then the one which is very inside or very deep, okay, that is called as the deep. So deep means it is towards pura insides of the body. Okay, that is that area we call it as deep. Okay, superficial is just over, or it can just be, we can just see also, but deep means it is pura inside. Okay, then visceral and parietal. Okay, so this type of this thing you might be, when you learn about the lungs respiratory system, you'll learn more in details about this. So just for example, what is called visceral, it is that part which covers, if you see from the diagram, okay, visceral, it is that part which covers the organ, and parietal, it is that part pertaining to a covering against a cavity wall. Okay, and if you see in this diagram of a lung, the one which is inside covering the lung, that is called as a parietal, and sorry, visceral, and the one which is another layer which cover the lung, that is called as a parietal. And in between the visceral and the parietal, we have the pleural space. Okay, so this is an example of visceral and parietal. Okay, this is again another explanation of the various terms which we use, okay, like superior, inferior, anterior, posterior, which I've said. Anterior means the front of the body, posterior means the behind of the body, okay. Then medial means, that is the one which if I have shown you in some diagrams, the midline, okay, that midline area we also call it as the medial, okay. Then the next we have is the lateral. The lateral is that area which is away from the midline or the outer part of the midline. Okay, like suppose your hand, your limbs, that is called as a lateral. Okay, and intermediate means this is that area which falls between your medial and your lateral. That means between the midline and your hand, whatever area it is, that is called as a, this one, intermediate. Then proximal means close to the body origin, like I've already given the example. Suppose in your leg, in your hip area is called as a proximal, and distal, it is that which is away from the body. Okay, superficial means towards the body surface only, and deep means which is pura inside or deep in the side the body surface. So this you can see, we have the anterior, posterior, okay, superior, inferior, proximal, distals, then the midline. Okay, you can see what that medial, lateral. Okay, so all this is there, and in the area between the midline and the lateral, that is called as your intermediate. Okay, so these are the different positions which you need to remember. Are you all clear with this?
Yes, ma'am.
Yes, ma'am.
Okay, and moreover, this one
Yes,
you can see
ma'am.
from the diagram only. So this actually
Yes, ma'am.
much better if I could, if you'll be here physically, then I can show. Huh? Yes. Just please mute your microphone unless you have any question. Okay. Anyone have any question? And the other name of anterior, it is also called as ventral, and posterior, we also call it as dorsal. Okay, sometimes. So these position you have to remember. Okay, so another anatomical terminologies like for the skull. Okay, so in medical term, we used to call it as the cranial. Okay, then the neck we call cervical. The elbow we used to call it as cubital. The wrist is the carpal. Then the front of the knee, that means your knee, that knee bone. Okay, we call it as the patella. Then eye, we used to call it as orbital. Okay, chest, thoracic. The groin area, we call it as inguinal. Okay, so all this later by when you will be learning more in details about anatomy and physiology. So all these terms you'll be coming in, you'll become this one you'll come across every time. Okay, this word cranial, cervical, or cubital. So during that time you'll be learning. Okay, so next we have the body planes. Okay, so what are body planes? These are imaginary flat surfaces that separate the body or the body parts into portions. Okay, these are not directly there, but it is just an imaginary line where when we try to divide any body parts. Okay, so mostly we have three major planes at the right angles to one another. We have the sagittal midline or the midline plane. So this sagittal, what happened when we, this imaginary line, it divides the body into two parts, right and left. Okay, then the transverse or the horizontal, as you can see from the diagram, it divides the body into inferior and superior. Okay, and the frontal or the coronal, then it divides the body into dorsal and ventral, or the front and the back, or the anterior or the posterior. Are you clear with this?
Yes,
Okay,
ma'am.
so just remember these body
Ma'am.
planes, they are imaginary flat surfaces and which divides the body into different portions. The sagittal, it is at the midline, so it divides the body into right and left side. Then the transverse, it is at the horizontal, okay, at the middle, as you can see. Then this, it divides the body into inferior and superior and inferior. And the frontal, which is also called as coronal, it divides the body into the front and the back, okay?
Dorsal and
So,
ventral.
yes, front or back or dorsal or ventral, okay? So anterior, posterior, dorsal, ventral. Then these, for example, okay, if you want to, this is just a simple example of how a brain is being divided. Okay, so this is a structure of a brain. Normally we have two hemisphere, right and left hemisphere. Okay, so the first one, it is the sagittal body planes, okay, where we divide the part of the brain into left and right. Then the second one, it is the coronal, okay, where we divide the body into the front and the back, or the dorsal and the ventral, okay. And the last one is the transverse or horizontal section of a brain. Okay, so this is just a simple view of the body planes. Okay, this one you just have to remember. Okay, clear? Are you clear with the positions?
Yes, ma'am.
Okay,
Yes,
when
ma'am.
you come back, I will ask each and
Yes,
everyone.
ma'am.
Okay, what is superior? What is inferior? What do you mean by anterior, posterior, proximal, distals? Okay. So
Okay, ma'am.
to be more specific, you can even draw this diagram. Okay, not directly from here. You can see like simple diagram from the internet, and you can draw it in your copy. Okay, when moreover, I have already shared the notes. So whenever you write the notes, also you can just draw the diagram. Then you'll be able to remember properly. Because in anatomy and physiology, we always have to draw some. Okay, we have to always give a diagram of any structure, especially for anatomy. Whenever we say anatomy, means compulsory. Diagram should be compulsory. Okay, so I hope everyone is clear with the different positions and the body planes. Okay, remember we have three types. The next we will see with the body cavities. Okay, so the human organs mostly it develops into so many major cavities, but we have the two main one. Okay, so I'll directly. Okay, the main body cavity which is divided, it is called as the dorsal cavity and the ventral cavity. Okay, so this dorsal cavity, it protects the nervous systems like your brain, your spinal cord. Okay, so this also you'll be learning more in detail. I think today also you might have some introduction class about the nervous system. Okay, so this dorsal cavity, where you'll find it, this you'll find it in the parts of the nervous system. Like for the cranial cavity, you can find it in the brain, and the spinal cavity in the spinal cord. Okay, and the ventral cavity, it usually covers, this is the cavity which is seen inside any visceral organs. Okay, for example, here they have given two subdivision, thoracic cavity. So thoracic cavity, where we can see this cavity in the lungs, okay, in the pleural or the lungs, in the mediasternum. So mediasternum, it is that cavity where all our heart, esophagus, lungs, and trachea, all this, they are being occupied in that space. In that cavity, in the thoracic cavity, all these different organs are being present in this cavity. Cavity, you understand, right? Cavity is like a hole, hollow area. Okay, that is the meaning of the word cavity. Then abdominal pelvic cavity also, we have the abdominal. Okay, in the abdominal cavity, what is there? We have in that cavity what type of organs is usually present there: stomachs, intestines, the spleen, the liver. So all these different organs, they are being present inside the abdominal pelvic cavity. And in the pelvic, we have the bladder, we have the reproductive systems. Okay, then the rectum. So all this occupy the body cavity. So we have two types of body cavity. We have the dorsal cavity, which protects the nervous system, which can be seen in the brain as cranial cavity, and in the spinal cord as the spinal cavity. And if you see ventral cavity, these are those which usually covers all the visceral organs or the soft organ. Okay, the soft organ or the visceral organs. So we have thoracic cavity and the abdominal pelvic cavity. Are you clear with this?
Yes, ma'am.
Yes, ma'am.
Okay, I
Yes,
hope
ma'am.
you are really clear. Okay, don't, if you have any questions, you can always ask. Okay,
Okay, ma'am.
okay, this is another just that same explanation about all those and all those body cavities. So another body cavities also, we have the mouth. Yes, our mouth, inside where we have all the teeth or tongue, gums. Okay, the nasal cavity, that means your airways or your nose. This cavity, you can see it inside your nose. We have some cavity, right, where we can breathe in oxygen, we breathe out carbon dioxide. Then orbital cavities, that means this is that area where our socket ball or eyeballs is being present. That is called as a orbital. Like I've already said, orbital is another name for the eyes. Okay, so orbital cavity, it is that cavity where the eyes are usually present. Then the middle ear cavities, your ear also, we have some cavities opening. Then synovial cavities, these are usually seen in the joints. Okay, in this are usually there because it usually helps in the movement. Okay, so in that type of the synovial cavities, you will see it in the joints. Okay, so are you clear with the body cavities? Okay, any question? No question. Okay, anyhow, if you have questions, you can always go through the slide and ask me in the next class. Okay. So again, we have some quadrants and regions. Okay, so quadrant and region is like an imaginary lines where we separate the different parts of the abdomen and the pelvic. Okay, so I'll be showing you the diagram. You'll be more clear when you see the diagram. Okay, so we have the abdominal, pelvic, quadrants, and regions. So in this one, in the quadrant, we usually have four type of quadrant. We have the right upper quadrant, we have the left upper quadrant, then the right lower quadrant, and the left lower quadrants. Okay, so in the right upper quadrant, if you see, okay, so what is usually present here? This is the area where a liver is usually present. So whenever you try to palpate, suppose if a person is having any form of problem related to the liver, so we should always palpate the right upper quadrant, or we will try to touch and feel the right upper quadrant for any form of pain or anything. Then in the left upper quadrant, if you can see, so here mostly we have our spleen or left kidney. Okay, then in the right lower quadrant we have the appendix. Okay, so and in the left lower quadrant we have the left ovaries and all this. So this is usually for a female. Okay, in female we have the left ovaries. Then if it's come to the regions, usually we have around 9 region. Okay, so first we have to, it is divided into 9 regions. So these lines are all imaginary lines which is being divided, where we divide the abdominal pelvic region. So if you see at the middle, we have the epigastric region. Then we have in the middle where the umbilicus is there, that area is called as the umbilical region. And just below the umbilical region, we have the hypogastric region, okay, where all the intestines, the stomachs, okay, so all those are usually there. Then we have again, it is being divided into right and left hypochondriac region. Then the middle one is called as the right and left lumbar region, and the lower one, it is called as the right and the left inguinal region. Okay, so this is it about the quadrants. You have to remember we have 4 quadrants and we have 9 regions. So you have to remember this name, okay? Epigastric region, the umbilical region, the hypogastric region. The hypogastric, it is below the umbilicus, and the epigastric, this is that each region which is above the umbilicus, okay? And we have again right and left hypochondriac region, lumbar region, and inguinal region. So all this region and quadrants you have to by heart and remember, okay? Then, and if you see in the top, we have the clavicles. Clavicles is this one, your collarbone. Okay, this collarbone is also called as the clavicles. Okay, then after that we have the mid clavicular line. That means the area between the clavicles, the mid line of the clavicles is called as the mid clavicular lines. Again, we have the right and the left mid clavicular lines. Okay, I hope everyone is clear. Yes.
Yes, ma'am.
Yes, ma'am. Yes, ma'am.
Yes, ma'am.
Okay, so actually this is just
Yes,
an
ma'am.
introduction of your anatomy and physiology. Directly, you might not get this in your exam, but you need to know it for your practical purpose, okay? So that's why I've given just the introduction. So from the next class, I'll be starting with my unit 1, okay? I'll be taking a top on the topic cells, okay? So I'll be teaching you all about what are the various types, what is cells, then what are the tissues, various types of tissues. So I'll be starting with your unit 1 in the next class. That means next week. Okay, so I hope everyone is clear with the topic, and please go through the slides, and if you have still have any doubt related to anything, you can ask me. Okay?
Okay,
That's
ma'am.
all for today.
Okay, ma'am.
Okay.
Okay, ma'am.
Okay.
Okay, thank you everyone.
Thank you, ma'am.
Okay.
Thank you,
Thank
ma'am.
you, ma'am.
Thank you, ma'am.
Thank you,
Ma'am.
ma'am.
Thank you, ma'am.
Okay,
Thank
take
you,
care
ma'am.
everyone. Okay. Now you can rest. And okay,
Okay.
one thing, please, all this, whatever notes is being taken, you please maintain copy. Okay, like for one subject, suppose if, like for example, anatomy, we have so many teachers. So one copy, you can maintain at least 2 teachers like that. But you have to note down all the notes. All should be in your copy. Because what happened, you cannot depends on the slides, and we will check your copy later when you come back. Okay, for your physical class. So make sure you copy all the notes. So it will be easy for you also to study later. Okay, fine.
Fine, ma'am.
Okay.
Yes, ma'am. Thank you, ma'am.
Okay, ma'am.